Hello, and welcome to your Liberty Military Housing Benefits Orientation. Today we are going to cover Liberty Military Housing team member benefits for the upcoming plan year. We will begin with our mission statement. At Liberty Military Housing, our mission is to provide military families with exemplary service in a quality home environment, employees with unparalleled opportunities for personal and professional development, and military partners with quality homes and vibrant neighborhoods. At Liberty Military Housing, we have identified 6 core values: balance, commitment, integrity, communication, empowerment, and respect. Let's begin with eligibility for our benefit plans. Liberty Military Housing is dedicated to offering significant benefits to you and your eligible dependents. All full-time team members working at least 30 hours per week are eligible for benefits on the 31st day of their employment. Additionally, you have 30 days from your date of hire to enroll in your benefits. If you are eligible for benefits, you can log into your Dayforce system and enroll yourself and your dependents that are eligible for enrollment before the 30th day of employment. This includes your spouse, dependent children under the age of 26, and disabled children over the age of 26. Don't forget, if you miss your deadline to enroll in benefits, you will not be able to enroll in benefits until the next open enrollment, or if you have a qualifying life event throughout the year. Next, let's talk about enrollment. Enrolling in your benefits is easy. You will receive an email from your regional benefits coordinator with the benefits guide and instructions on how to enroll in your benefits. Next, you will log into Dayforce and add any eligible dependents before you elect your benefit plans. Before you finish your enrollment, remember to add any beneficiaries to your company-paid life insurance. Click Submit Enrollment to complete your benefits enrollment in Dayforce. Lastly, submit your dependent verification documents to Alight. Liberty has partnered with Alight, also known as Aon Hewitt, to provide dependent verification. Alight will mail you a letter with examples of verification proof, which you can submit before your deadline. If you are enrolling your spouse and/or dependent child or children in medical coverage, you must provide dependent verification within 45 days. If you do not provide proof of your dependents by the deadline in the mailing sent to you from Alight, your dependents will be removed from your plans. What happens if you and your spouse both work for Liberty? If each of you were covering one or more dependent children, only one of you can enroll in family coverage. If you are not covering a dependent child, one of you must enroll in Team Member Plus coverage. You cannot enroll in Team Member Only coverage. Now let's talk about qualifying life events. You may change your benefits if you have a qualifying life event throughout the year. However, you must provide proof of your qualifying event within 30 days of the event. Types of qualifying life events include birth or adoption, death, change in marital status, loss or gain of the coverage, and a change in employment status. There is a 2-step process you must complete in Dayforce. The first step is to submit a life event declaration form in Dayforce. This can be located under Benefits, then Forms. Next, depending on the information provided, the National Support Office Benefits Administrator will approve or deny your request. Once approved, you must change your benefits elections and choose Submit. Now let's talk about Liberty Paid benefits. These are team member benefits Liberty pays on our behalf. One of our company-paid benefits is basic life and AD&D insurance. Liberty covers basic life and accidental death and dismemberment insurance through Prudential, which offers up to 2 times your annual salary, up to the maximum of $150,000. You also have the opportunity to enroll in additional supplemental life AD&D coverage. Don't forget to add a beneficiary. Another company-paid benefit is long-term disability insurance. Long-term disability, also known as LTD insurance, provides up to 60% of your monthly salary in the event that you are disabled. The monthly maximum benefit is $20,000. Keep in mind, there is a waiting period of 90 days from the start of your disability. This means you would not receive disability payments until after you have been disabled for more than 90 days. The duration of this insurance is until you reach Social Security retirement age, or if you are no longer disabled, whichever happens sooner. Survivor benefits available are 3 times the last monthly benefit payment if you were on long-term disability and unfortunately have passed away. Next, we'll talk about our company's paid employee assistance program. This program is provided through ComSite. It is unlimited use of confidential assistance 24 hours a day, 7 days a week. This program is available to you and your family members free of charge. The Employee Assistance Program offers help with depression, anxiety, child care, financial concerns, relationship issues, and much more. All team members and their family members can receive up to 3 in-person counseling sessions per person, per issue, per year. There are also unlimited online resources available, including articles, videos, and interactive tools. Another great benefit we have is Perks at Work. This is a free employee discount program available through our EAP program. Perks at Work is available to all of our team members. This program offers many exclusive savings, including access to 30,000 national and local discounts. It also offers free online courses through Community Online Academy, or COA. For more information, go ahead and visit www.perksatwork.com/LMH Service Inc. A few additional company-paid benefits that we offer include EAP sessions, Legal Connect, Financial Connect, and guidance resources online. Now let's talk about our benefits plans. Before we get into our benefit plans, let's discuss insurance terms that are commonly used throughout medical, dental, and vision insurance. Let's begin with deductibles. Our medical plans include a deductible where you are required to pay for services out of pocket before your plan starts paying. You only pay up to a fixed dollar amount each year. This is your deductible amount. Deductibles reset every calendar year from January 1st to December 31st. Next, we have out-of-pocket. Once the out-of-pocket maximum has been reached, your plan will pay 100% of the amount for covered health benefits for the rest of the plan year. The next terms are co-payment and co-insurance. Co-payment, also known as copay, is a flat fee that you will pay for medical expenses while your plan pays for the rest. For instance, our telehealth program has a $25 copay. Co-insurance is a percentage of what you will pay versus what the company will pay. Co-insurance starts after your deductible has been met. Now let's talk about networks, including in-network and out-of-network. For more cost savings and less out-of-pocket, we want to ensure your provider is in network. This will be any primary care physician, specialist, and urgent care. Selecting out-of-network will result in paying more for services. We have 2 medical plan options to choose from for our current plan year. The HRA plan has an individual in-network annual deductible of $1,750 and out-of-network deductible of $3,500. The copay plan has an in-network deductible of $1,000 for individuals and an out-of-network deductible of $2,000. For family, the HRA plan has an in-network deductible of $3,500 and $7,000 for out-of-network. The copay plan has a $2,000 in-network deductible for families and $4,000 for out-of-network. You will notice big differences between copays and coinsurance for both plans. Preventative will always be free of charge for you if you stay in network. For primary care visits, you'll notice on the HRA plan there's a 20% coinsurance after the deductible has been met. The copay has a $25 copay if you were to see an in-network primary care physician. For more information on our plans, please visit our benefits page on the Knowledge Center, or you can download our benefits guide. To help you understand more about our medical plans, here's an example of coverage. In these examples, Peg is having a baby, and Joe is managing type 2 diabetes. You will notice at the bottom, the total Peg would pay on the HRA plan is $3,970 out of pocket, while on the copay plan, she would pay $3,360. Please note that these examples do not include the team member HRA funds that are given to you if you enroll in the HRA plan. For Joe, if he were to be on the HRA plan, he would spend $2,470, while on the copay plan, it would be $1,140. Again, the HRA plan is not including that HRA fund that is given for free. Now let's talk about medical prescriptions. The HRA plan and copay plan offers medical prescriptions. Under the HRA plan, retail prescriptions are covered at 20% after the deductible has been met. Under the copay plan, retail prescriptions coverage ranges from $20 to $60 after the deductible has been met. For mail order prescriptions under the HRA plan, mail order prescriptions are covered at 20% after the deductible has been met. And under the copay plan, mail order prescriptions coverage ranges from $40 to $120 after the deductible has been met. Now let's discuss working spouse surcharges. If a team member's spouse is employed and has access to medical care coverage through their employer, they are subject to a monthly surcharge when electing Liberty's medical coverage. There is a $100 monthly charge if electing your spouse. $50 will be deducted twice per month. If your spouse doesn't work or works part-time, is not eligible for coverage, or has lost coverage, the spousal surcharge does not apply to you. Additionally, if your spouse is covered under Medicare, the surcharge also does not apply to you. Next, let's go more in depth about HRA. HRA, also known as health reimbursement accounts, are employer-funded accounts that pay for eligible medical, dental, and prescriptions out-of-pocket expenses. And HRA helps with the offering of your deductible. It is only available if you're enrolled in an HRA medical plan. Only Liberty Military Housing can contribute to the HRA plan. Any unused HRA funds can carry over to the next year up to the maximum of $1,500 for team member only coverage or $3,000 for family coverage. Here is a breakdown of our plan and how much you are given each plan year. Our HRA funding for team member only insurance is $750, and for family coverage it is $1,250. Please note that if you are a new hire within the current plan year, the amount is offset and prorated based on your eligibility date. This means that if you are hired within January or March, you will receive $750 for individual-only coverage and $1,250 for family coverage. If your eligibility date is between April and June, you will receive $563 for team member-only coverage or $938 for family coverage. And if your eligibility date is July through September, you will receive $375 for individual coverage and $625 for family coverage. Lastly, if your eligibility date is October through December, you will receive $188 for any individual coverage or $313 for family coverage. Another great benefit available to everybody who enrolls in our medical plans is free preventative screenings. Our medical plans cover these exams at 100% when you use an in-network provider. Not all preventative care is recommended for everyone, so you will want to talk with your doctor to decide which services are right for you and your family. Some of the preventative care services include, but are not limited to, wellness visits, physicals, and standard immunizations, screenings for blood pressure, cancer, cholesterol, depression, obesity, and diabetes, pediatric screenings for hearing, vision, obesity, and development disorders, anemia screenings, breastfeeding support, and pumps for pregnant and nursing women, iron supplements for children ages 6 to 12 months at risk for anemia. Now let's talk about some of the free programs offered by Cigna. If you enroll in one of our medical plans, Cigna offers the following free programs and apps: mobile app through MyCigna, Cigna Health Pregnancy, lifestyle management programs like weight loss management and stress management, discounts on gym memberships, nutritional meal delivery services, free behavioral programs like iPrevail and Happify, free health assessments, and you'll also have access to Cigna's 24/7 health information hotline and other wellness discounts provided to you also if you're a new hire. If you have any questions before enrolling or during open enrollment, deciding which plans to choose from, you can always call the Cigna pre-enrollment hotline at 1-800-401-4041. Next, let's talk about MD Live. Cigna's telehealth program is provided by MD Live. You will have access to board-certified doctors available to Cigna 24/7, 365 days a year via phone or video consultation. It also includes behavioral and mental health virtual visits with a licensed counselor or psychiatrist. The cost is a $25 copay whether you're on the HRA or the copay medical plan. Cigna also has some great online tools available on their mycigna.com website or through their MyCigna app. You can also find a provider or facility, order a new ID card, refill your prescriptions, manage claims, check benefits coverage, and also get an estimate on the cost of procedures or medication using the Transparency Cost Tool and Pricing Medication Tool. Now let's talk about our dental plans. Liberty Military Housing offers 2 dental plan options for you to choose from. Liberty's Cigna Dental Plan provides coverage for preventative, basic, and major services. The first one is our core dental PPO plan, and then we have the buy-up plan, also known as Enhanced Dental PPO plan. Here are the cost differences between them on a bi-weekly basis. Cigna provides in-network and out-of-network dental coverage. However, you will save money if you visit a Cigna in-network provider. You will notice similarities between both plans, except for the annual maximum, which is $1,500 for core PPO plan and $2,500 annual maximum for the buy-up enhanced PPO plan. Vision insurance is provided by Superior Vision to benefit eligible team members. The benefit is designed to help reduce the cost of eyeglasses, contact lenses, and other vision services. Coverage is available for all providers. However, you will save money by using a Superior in-network provider. If you choose to see an out-of-network provider, you will be responsible for filling out your own claim forms. Our vision plan offers a 20 to 50% special discount on LASIK offered through QualSight LASIK. For more information, please call 877-201-3602. Now let's talk about some of our voluntary plans that are offered to you. Liberty offers benefit-eligible team members with a company-based basic life and AD&D benefit that equals 2 times your annual salary, up to $150,000 maximum. Basic life and AD&D is provided by Prudential. Life and accidental death and dismemberment, or AD&D insurance, provides financial protection to your survivors. Each benefit is 2 times your base annual earnings rounded to the next $1,000. You have the option to sign up for additional insurance in AD&D for you, your spouse, and your children. For team members' voluntary life insurance and AD&D, you can sign up for increments of $10,000 or more, up to the amount of $1 million, not to exceed 4 times your annual salary. Please note that there is a guaranteed issue amount of 4 times your annual salary of $500,000. For your spouse, you can sign up for increments of $5,000 up to a maximum of $250,000. However, this cannot exceed 50% of your own approved amount. The guaranteed issue amount for spouse life insurance is $25,000. For children, you can roll in up to $10,000 per child. Please note, there's an evidence of insurability form that must be completed if you are electing any amount over the guaranteed issue amount, or as a current team member, you're adding an additional amount. In addition to the basic life and AD&D insurance provided automatically to you by the company at no cost, you have the option of purchasing supplemental life and AD&D coverage for yourself through Prudential. This is only available for team members who make over $75,000 a year. Team members would pay their deduction per paycheck rather than being a company-paid benefit. Next, let's talk about flexible spending accounts, also known as FSA. A flexible spending account, or FSA, allows you to set aside money to pay for eligible health and dependent care expenses with money that's automatically withheld from each paycheck before taxes. Liberty provides flexible spending accounts through a tax saver plan, and you must re-enroll in any FSA every open enrollment. There are 2 types of flexible spending accounts: a healthcare FSA and a dependent care FSA. The healthcare FSA annual maximum is $3,050, while the dependent care FSA annual maximum per household is $5,000. It is a use it or lose it policy, which means whatever money you do not use at the end of the plan year, which runs through December 31st, you will lose that money the next year. Please note, there's also a run-out period which ends March 31st. Next, let's discuss our retirement plan options. We have a 401k plan provided by Principal. All team members, including full-time, part-time, and temporary team members who meet the eligibility requirements, are eligible. Eligibility requirements include You must be the age of 21 or older and a full-time team member after 31 days of employment. Part-time and temporary team members are eligible once 1,000 hours of service are completed. These contributions are pre-taxed every year, and the contribution limits are $22,500. If you are over the age of 50, you may contribute an additional $7,500 to your 401k plan. This means if you are 50 or older, you can contribute up to $30,000 every year. Liberty provides a discretionary employer match of 50% up to 5% of your compensation. For example, if a team member contributes 10% of their compensation to their 401k plan, they will receive 2.5% of the 401k match amount. We do have a 4-year vesting period, meaning that if you've been with the company for 4 or more years, you will be 100% vested with the employer match. Our Employee Stock Ownership Plan, or ESOP program, is provided by LMH ESOP Holdco. Liberty Military Housing is a 100% team member-owned company as of January 1st, 2021. ESOP is a long-term retirement plan funded by Liberty. Team members are auto-enrolled after meeting eligibility requirements. You are automatically enrolled after meeting the eligibility requirement, including working 1,000 hours or more within a 12-month period or plan year, being at least 21 years of age, and during the entry dates of January 1st and July 1st. Please note that we do have a 6-year vesting period. Once you have been with Liberty for 6 or more years, you will be 100% vested in this plan. Lastly, let's discuss a leave of absence. Liberty offers paid parental leave for eligible team members in the event of birth or adoption of a child. To be eligible for paid parental leave, team members must have worked for Liberty full-time for at least 3 full years before the leave of absence is to start. Eligible team members may receive up to 12 weeks of paid parental leave, which is up to 60% of their weekly base pay during leave period for up to 12 weeks. Overtime hours, bonuses, and commissions will not be calculated in the base pay. Parental leave can be used for recovering after childbirth and/or caring for and bonding with a newborn or newly adopted child under the age of 18. Paid parental leave starts after childbirth. If you have any questions, please don't hesitate to reach out to your regional benefits coordinators in your area. For additional information, please visit our benefits page on the Knowledge Center. Liberty Military Housing is committed to providing our benefit-eligible team members with exceptional benefits that meet the needs of our mission and our core values. Thank you for watching.